In the beginning, the healthiest and best stewards of the planet lived here. They lived in concert with land and seas, developed hunting and farming techniques. They created art with deep meaning, and they passed down stories and cultural practices with power to preserve our planet. At that time, the first Americans and the Earth thrived. Today, Native peoples are suffering from the poorest health, education, and economic status in the United States. The Johns Hopkins Center for American Indian Health was founded to restore American Indian well-being and share our solutions with the world. 35 years ago, when a young Johns Hopkins pediatrician learned that American Indian children died at rates 10 times the U.S. average, his life, and millions of others, changed forever. In 1980, Dr. Matu Santosham began research with the White Mountain Apache on oral rehydration solution. Apache outreach workers taught parents to use this solution with sick babies in their homes. It stopped widespread deaths from diarrhea and vomiting. Today, it is known as Pedialyte. Their discovery was sent around the world. An estimated 50 million lives have been saved. In 1991, under Santosham's leadership, Johns Hopkins founded its Center for American Indian Health. Research continued. Navajo and Apache tribal partners helped prove new vaccines against meningitis, rotavirus, and pneumococcus, deadly germs that attack Native children at extremely high rates. American Indian children were the first to get the new vaccines, which now benefit children across the U.S. and the world. In the next decade, more than 5 million children's lives will be saved worldwide. Behavioral and mental health issues now pose the greatest threats to American Indian communities and the world. The center is working with tribes to tackle suicide, diabetes, obesity, drug abuse, HIV, and AIDS. With the White Mountain Apache, the center is pioneering suicide prevention strategies. Native mental health workers track surveillance data and scour the reservation to reach youth at risk. They counsel them through challenging times and connect them with elders who teach traditional values about the sacredness of life. They recreate a web of hope. The center is now scaling this model across other communities. Because the roots of mental and behavioral challenges are early in life, the center's Family Spirit program was created to serve expectant mothers and their children through home-based parent training. The center has proven that Family Spirit mothers overcome depression and substance use while increasing parenting skills. Their children benefit from healthier social, emotional, and behavioral development. More than 55 tribal communities are now using Family Spirit. The city of Chicago is the first to adopt Family Spirit for Latino and African American families. Over the next 5 years, the center plans to reach 100,000 more families. The center is also working to end childhood obesity and diabetes. Feast for the Future works to ensure long-term cultural transmission of farming techniques and traditions to encourage healthier lifestyles and reduce diabetes. Family health coaches trained by the center prevent diabetes through home-based education on nutrition and fitness. Using sports as a hook, Native Vision taps the power of positivity to link children to healthy futures. Over the past 20 years, Native Vision has reached thousands of children through camps and after-school programs. Thousands more await. The newest light on the center's horizon is the Youth Entrepreneurship Program. With unemployment rates as high as 80% in some tribal communities, kids are losing hope. Resources and talent from Barclays Bank have helped the center build a model that blends business and life skills training with cultural empowerment. Results show kids are staying in school, getting jobs, and starting businesses. At the core of the center's mission is training the next generation of Indigenous health leaders. From high school through postdoctoral training, Johns Hopkins Center for American Indian Health is supporting a pipeline of education. 500 Native scholars will graduate over the next decade. For a quarter of a century, the Johns Hopkins Center for American Indian Health has been overcoming health disparities with its tribal partners by blending cutting-edge science with profound cultural strengths. This work deserves a future. With your help, we will restore the well-being of the First Americans and our planet.